Welcome to the Erect posture presentation. If your job leaves you with neck, shoulder, and or back pain, fight back by willfully contracting the muscles that hold your spine erect in the erect posture's seated exercise. The prescription that's special to this one is make your contractions only as strong and hold only as long as needed to back off pain. Now, this is a special one. I teach how to sit up straight and how to hold muscles right tight for just learning to sit up straight. But this one is in a special case. This is job related. You've done your job. I've had this job. You've done your job, and it's put pain in your body. It's left you feeling strain and pain in the body. And now you're coming up out of it. You feel bent and painful. What do you do then? The treatment is, it's just go into erect posture. Just pull up into it. And go there so that it's about the contraction of a yarn, but the yarn is meeting the needs, tightening the muscles that need tightening to get you back straight. Okay? And that's what I'm teaching. That's what's special. On top of that, you're doing everything else. You're learning to sit up straight. This is just an extra bonus that I found would back me out of pain. How to sit erect to strengthen core muscles and relieve low back pain. To avoid the pain of shoulder, neck, and back that comes with a job of heavy labor requires a strong vertebral spine. The exercise for this setting is the habitual strengthening of the muscles that erect the spine, namely the chain of deep intrinsic spinal muscles, and there are 6 initiator muscles. These are the same muscles that hold the spine erect in healthy seating and standing postures, but their strength needs increasing when a job requires increased strength. The lumbar spine is the site of most job-related pains. The activator muscle for the lumbar spine is the transversalis. Increasing its strength counters low back pain. I'm Dr. Gwen, a retired orthodontist and yoga teacher. And this is the fruition of a desire or a goal where I decided I wanted to learn how to correct body posture as reliably and as scientifically as orthodontists correct teeth. Orthodontics is very logical, science-based, and you know how to straighten teeth when you know how to straighten teeth. I wanted to see if that couldn't be done for the body. And this is what I present to you. Start with thanks. I want to thank in preparation of this one, I talked to workmen, people who do heavy lifting jobs in Ormond Beach area, and they shared with me how they handle their pain. I want to thank you for joining the class. I want to thank the person who referred you to the class. Please subscribe, ring the bell, like, refer others, and feel free to comment. Leave comments. Erect posture is what is needed to get out of body pain. Body pain comes from poor posture. And erect posture, then you need to get to know it. This is erect posture. I will describe erect posture as 3 balanced spinal curves over a level pelvis with the head held high. Erect posture. These spinal curves right here, shown here and here, are characteristic of human. Okay? So all of us have it. They may not be, like nothing we do, nothing we have is the same. So the curves are not the same, but when they are erect, they are all three there. If you have wide open curves, you have it all the way down. If you have slight curves, you have slight curves. The depth of the curves is genetic, okay? When you're looking at someone in the front, the only thing I can tell you to look for is the collarbone being level. What I mean by the collarbone being level, collarbone running straight across as compared to the collarbone running up in a heel. It runs across when the back is erect. When the back has the three curves. Okay? The treatment goal is to teach you posture correction to eliminate the lower back pain caused by poor posture. The exercise consists of stacking the bony spine plumb with gravity by engaging the postural muscles designed for the job. The postural muscles designed for aligning the spine are right in the areas of those blue dashes, red dashes, right in there. And that area is filled with muscles, and they are the muscles that erect the spine. And those are the muscles you must learn to talk to. When you see someone erect, 3 balanced spinal curves over a level pelvis, topped with a head held high, it has the same look standing and sitting. There it is standing. After that, when the pelvis has changed its tip, here's the pelvis at its normal tip. Here it is with the tail lifted, tail tucked, tail lifted. Anytime you do either one of those, you've changed. The spine can't get right. I want you to know you're relearning how to stand up straight, because I want you to know that all of us, if you go back and find your 4-year-old picture or you find your 3-year-old picture, what you will find is you knew how to stand up straight at one time. That's what we did. We learned how to stand up straight, and then we got so good at it, we got bad at it. I was taught that the way we got wrong was we learned to sit wrong. And so learning to sit erect is the treatment goal in the erect posture, because that's what we need to correct our spine. Once you lean that body over, gravity then takes it. So we started out straight. We learned how to stand wrong. We sit really wrong. And then once your body gets out here, with time, gravity takes you and bends you. And we call that age. I call those poor posture of old age. It's just time and poor posture, gravity beats you down. And what you need to do is you need to learn to sit up straight, because at 82, that's what I've done. I've practiced sitting up straight, and therefore I can sit slump just like everybody else. But I put in time sitting up straight so that as to counter poor posture. There are rules. We're about to learn how to sit straight. So you're sitting in a chair. Here are the rules we got to go by. There is no gain in pain is number one. If it hurts, see, the whole idea that I'm teaching is I'm teaching you how to get your posture right. Well, your posture won't be right if it puts you in pain. So if you get in pain learning how to do this, then it's time to stop. Don't do it. I might not be able to help you. What I say is don't work too hard. Strong contractions are not postural. So go softer. If you feel pain doing what I tell you to do, then go softer. But if it hurts, you can't do it. Next thing is postural muscles are contracted very softly. So when I'm telling you what to do the smallest amount of contraction it takes to hold you in the position I've described, except at the one level, at the waist. At the waist, you can go as tight as you want. That's where the fire can be applied. Everywhere else, go cool. Don't put too much energy into it. Number 3, but you can go very hard at the waist. Okay? Number 3, when you finally get up straight, flicker. We're not trying to be statuaries. We're not trying to be statues. We're trying to be learn posture. And I'd rather that you move a little bit. Some of the tissue in the body needs movement to get right. So after you learn how to put all of them in, then move. You can move forward, backward, side to side, but the idea is just to move. Number 4, when you do the minimum is 7 breaths, 7 times a day. This replaces sit-ups, okay? When you learn the breaths, and if that's all you want to do is 7 breaths, 7 times a day, you will get change from that. That will be your sit-up, and you will get change. The more you do past that, the better. But your minimum is 7 times a day, your breath plus 1, so that you do me 50. Okay? The best practice for sitting upright is once you learn how to sit upright. Sit upright. Find times to sit upright. Give yourself 30 minutes. My practice time is when I'm talking to you. I'm actually watching myself sit up straight. I'm making myself sit up straight. And therefore, this is good for me. Teaching you is good for me. Okay. Now we're about to start learning how to sit up. And there are 7 steps. The 7 steps are in these geometries here. The first one is a square. That's your base, or a quadrangle, 4 angles. And the 4 parts of the 4 angles are the 2 feet and the 2 tuberosities. I gotta tell you, what's unique about your base is the thing I was taught when I first went into this is that the chair is your problem. And that's because if you sit in the chair with your thigh on the chair, remember, the characteristic of the erect posture is 3 curves, 3 spinal curves established. The mutable, there's a 4th one down here, but you can't change it. So the characteristic of erect is that you have those 3 curves. If you sit in a chair, slide all the way back, like it's described in choosing your office chair, slide all the way back so your thighs on the chair, your knees at 90 is perpendicular to the floor, your thighs are parallel to the floor, then you rest on your lumbar support. What they're telling you is, once you do that, you cannot sit up straight in that setting. You absolutely cannot sit, at least I can't, okay? I can't say that there's some people who cannot sit up straight. I will just tell you, the way I was taught and my observation is people do not sit up straight. They sit up straighter than some, but if you don't have 3 curves, you're not sitting up straight. And I haven't seen anybody with the 3 curves with their legs parallel to the floor. What you must do now, here goes instruction. Slide to the edge of your chair, so your ischial tuberosity, which are your sit bone, okay? Your 4 contact points include the 2 sit bones, okay? Your sit bones are the bottom of the pelvis that are rocker shaped. They are near the edge of the chair, so that you feel your sit bone contacting the chair at your gluteal fold, along your gluteal fold, and you're securely on that chair with your sit bone, the bones contacting the chair at the level of the gluteal fold. Okay? Now, but your thigh must go downhill. If your thigh is parallel to the floor, you rock back. You don't want to rock back, so you make your thigh go downhill, and your whole knee, your entire knee, needs to be below the level of your contact to the chair. That will make your thigh run downhill. And to show you my thigh running downhill, I'm sitting pretty low to the chair now. I mean, the camera is pretty low. But there is my thigh in this black, I'm having a hard time showing it. There's my thigh, and it's showing you how it runs downhill as compared to that blonde stick, which is running parallel to the floor. So my thigh is running down like that, okay? That's what you want. The way to get that are 2 I'm giving you today. One is sit on the chair and extend your feet like that so that your knees just drop down because your legs are slanting down. Just extend your legs to let your knees slant. That's one way. The next way is cross your legs, cross your shin. Let your knees drop out, and that'll make your thighs slant down. Those are the two ways I'm teaching today. Those are the simplest ways. Pick one or the other. Cross your knees, cross your shin, and let your knees drop out. Your thighs will go downhill. Extend your feet. Your thighs will go downhill. I'll be perfectly honest. I personally, now because I've had knee surgery, my knees don't like that. I have to do this one. I sit like that. Or you can sit with a higher chair, but that comes later when you've had time to learn how to do that. Or when you have the equipment for that. And today we're going without equipment. And I tend to teach without equipment so that people can just come in and start learning. The next thing is you got to level your bowl. To level your bowl, you remember, level the bowl and then stack the spine. To level your bowl is your pelvis. The pelvis is bowl. Pelvis means chalice or bowl in Latin or Greek. Okay, so it means bowl because it does have a content. It's a bowl with a content. The content is the peritoneal sac. Inside of it are the large intestine, the small intestines, the liver, and the stomach. There are other smaller organs in there, but those are the large organs. The kidney is behind it, the great vessels are behind it. But this is the sac that's sitting in the pelvis that we're going to use like a level to find out when this bowl is level. The ischial tuberosity is rocker shape. And so that's what we're going to rock on to check out and to establish when that bowl is level. That's the reason I can't teach you standing. I don't have any way of telling you or teaching you or programming you for finding level. I can in the seated posture. In the seated posture, I have you sitting on your ischial tuberosities, and then I get you to put your hand like this. Look into there. See how I got my hand like I'm holding a bouquet. I put that up against my body. That makes my shoulder just drop. I don't have to tell you how to get your shoulder in the right place if I can get your hand in this position, because it will let your shoulders just drop down and create a space for you to level your bowl. Now, once you have your hand in this position, I want you to, you're going to rock on your ischial tuberosities. And let me get a good view of me. Rock, 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 rock. Trying to get so you can see me. Rock, 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 rock. I'm rocking on this ischial tuberosity. When I rock forward, I dump my gut. It's like I lift my tailbone off the chair and dump my gut. When I rock backwards, I drop my tailbone to the chair and my ribs impinge on my gut. Rock forward, dump, rock back, impinge. Rock back, forward, dump. Feel the dumping happening. Rock back and feel your ribs catch your gut in between the pubic bone. Okay? Now you want to get so you do neither. Since sitting back on your tailbone is what most of us do when we're doing wrong, we don't need to go there. We need to learn what the dump feels like. And to get the dump, just roll forward so you feel this area overcurve and your gut dump out in front of you. And then drop back until you start feeling the impingement. And then go back up and find the point where you neither dropping that gut down and trapping, or doing, and find the point where you'd say neither is going on, and for me it's right there. There's my point where I'm neither dumping nor slumping. I call this slumping. So I find neither dump the gut out, or slump and let the ribs come down. And once I find a point where by my own feet internal level, I'm not dumping. If I go any further forward, I'm dumping. If I go any further back, I'm slumping. Find that point and let that point of the ischial tuberosity to the chair become familiar to you. because that's how I work. I no longer need to dump, slump, dump, slump, dump, slump. I know exactly where I put my ischial tuberosities to the chair, and I can just sit down and poke them to the chair. That's how I work. But it's going to take you a while to learn that. But once you get there, just put it to the chair. Just put it to the chair, and now you have a level bowl. We're like children learning to carry milk in a bowl. And so we're not dumping or slumping. Dumping or slumping. We're in between. Once you have that in between position, we're ready to start stacking. So let me tell you what I mean by stacking. So that was up to level 2. Okay. Before we go to level 3, let me explain stacking. The spine is what we stack. And we stack it in 3 curves. And all humans have 3 curves. That's Homo sapien. And the curve varies for everybody. Like there's everybody got a different fingerprint. Every tiger has different stripes. Every zebra has different stripes. Everybody's different, but everybody is the same. In other words, all zebras are zebra-like because they have the same structure, anatomy, and bones. All of us are human. All of us have 3 curves. All of us got it before we stood up straight. Every baby, before they walk out into the world, establishes 3 curves. Okay? Then we lose it. And when I say stack it, here's what I mean. The vertebra, the weight of the body is borne by the spine. That's where we carry all the weight up, right? And it's flexible. And when it's right, there are 3 curves. There's a lumbar curve, a thoracic curve, and a cervical curve. The lumbar curve has the form it has because of the shape of the bodies of the vertebra, the bony vertebra. Here, the drum sage. That's where flexion and extension take place. That's where most motion actually takes place. The facet joints in the back direct the movement, but the movement takes place on these vertebrae. These vertebrae form this curve because these bodies of these vertebrae are thicker in the front, thinner in the back. You stack bricks that are thicker in the front, slimmer in the back, and you get that curve. The thoracic vertebra, the bodies themselves, are thinner in the front, thicker in the back, therefore that curve. So that's how you got the curves. It's in the bone. It's in the cervical too, but it comes by a different mechanism. It's in the bone, but it's in not the bodies, it's in the facet joints in the back. But the bones, when they're stacked, ideally, they make the 3 curves. So what stacks the bones ideally? Muscles right behind the joint. Right behind the joint. The joints have projections behind them. These are the joints up here. The vertebral joints are here, and behind there are the projections. The spinous process, the transverse process, and this whole space in here, when it is filled with the muscles that control that position these joints. And that makes the muscles very close. They are short muscles because they only run very short distance, although their combined action is to run the entire length of the spine. Very short muscles run very short distances, and they together make a long woven braid of muscles. And when those muscles contract, they stack the spine. They don't extend the spine, they stack the spine. Muscles behind them, if you want to extend this spine, muscles behind them will extend the spine way back. But these muscles don't have that type of range of motion. They're short. They're short muscles close to their joint. That makes them powerful. Short muscles close to the joint are very powerful muscles, but they don't have any range of motion. So they're not going to extend your spine. The extension of the spine are all those muscles behind there. Even the muscles called the erecti spinae are behind there, and they're long. They have the long range of motion that can extend the spine. But these muscles right here don't have that type of range of motion. They stack the spine. And stacking is extension for the spine. And that's convenient since posture and gravity take you this way. These muscles are gravity defiers. They protect you against gravity collapsing you. Any muscle in front of the bodies of the vertebra, in the front of the body, flex the body. Any muscle behind the deep intrinsic muscle extend the body. Therefore, what's wrong? You hear somebody say you need strong muscles in your waist, and then they go to erecti spinae, not the erecti spinae, the rectus abdominis, the one that makes the six-pack. Well, he's in the wrong place. He flexes. He'll be the one who when you say, people say, if you exercise too much, you overdevelop. No, you're developing the wrong muscles. You've gone ahead. If you go back here and overdevelop it, you'll extend, flex. These are the only ones that stack. And so our goal has to be to stack them, to get them to correct. And how do you get them to correct? Okay? Here they are. Here are the four muscles. The intertransversalis, transverse process, interspinalis, spinal processes, and then from the side out, you have two muscles. Rotatories, they can say there are two of them. See, you got to be real careful when you start naming things because the anatomists have a thing going over there. So the rotatories can be longus or brevis in some companies. This company has longus and brevis. Some of them just have one rotatories. When there's more than one rotatories, there are more multifidus. If there are two rotatories, like it goes from here to here and then from here to here, then there are two of them, and then there's one less multifidus. I group both of those in the same group and put them in there. Those are the muscles that stack the spine. They sit in that space right in there, and there they are. Because they are a whole bunch of muscles, they look like chopped up here. That's because you don't get the muscle running at its full length. You cut it off here, you go into the next one, you cut it off there. This is from the Visible Human Project. It's copyrighted by National Library of Medicine. You have access to it too. I have the label on it somewhere else, but you will find it in my work often, and it allows me to look at the body. And what this shows me is this right here is the body of the vertebra. This right here is the spinous process, and this is the location. Look how big those muscles are as a collection compared to the body of the vertebra. And they run the entire length of the spine. In other words, we're not talking about a little bit of muscle. We're talking about a lot of muscle mass, which is not active as it should be if you don't have erect posture, right? And when you're sitting and you're sitting all slumped, you're not using them. So that's what we're teaching. I'll tell you that this chart right here will come in handy if you want to go back and find out what muscle, how do you activate these muscles? How do you activate them? You cannot talk to them. I'll just tell you that. They're voluntary, but they're not voluntary like the rest of them. I can't just tell you to extend your spine in your lumbar area and isolate it to these. I cannot do that. I can't do it. But it's because they just don't do it that way. How do you then talk to these muscles? You must find a muscle outside of the spine where the only way it can do its job, in other words, you give it a job, you give it a command, and you say, do this. The only way for you to get these muscles in here to contract is to find a muscle in that area where the only way for it to do whatever you're telling it to do is for these to tighten and make the spine a site of origin, a strong, stable site of origin. Now, and I'm telling you, it's in this chart if you want to know how to get the spine active in each one of these areas. The muscles have been identified. I will show it to you later. If you want to find it, it's in this chart, okay? That's the chart that I give for it. But we're about to start it now. So the first curve we're trying to get, so now we're going back to the 7 steps. So now we're at level 3, and level 3 is the lumbar spine. And it's called, most people think of it as the core muscle. When they say contract your core, you need strong core muscles. Most people then think rectus abdominis. No. No. He may be in the core, but he's not the core muscle. The core muscle that affects the spine is the transversalis. To know that that is the one, here's what you can do. You can Google the abdominal muscle. You say it 2 ways. That is best predictor. Strength in this particular muscle. Which strength in what abdominal muscle will say that you will not have low back pain? It'll be transversalis. Say it another way. Weakness of what abdominal muscle is the best predictor of pain? Transversalis. It is the transversalis that if you have low back pain that you need to get to know. You need to strengthen him. And now I have to tell you how to do it, okay? And do it in a seated position. See, most times you go in there and you find it, they have you doing the plank, the this, the that, the that. But postural muscles do best when you teach them how to work in the position that they need to work. And so since you don't really have a lifetime need for a plank, but you need to know how to sit up straight, then you have to find out how do you get the muscle to fire up when you're sitting up straight. Here's the thing you ask for. You cannot say, transversalis, I'm sitting up straight, tighten. No. You have to say to yourself, I want my waist to be as small as possible. Why? Contract your muscles to make your waist as small as possible. Because that's what the transversalis can do. He's the only one who can do it. He's a circular motion. He is your waist cinch, your waist cincher. He makes your waist small. So he has his active fibers, his contractile tissue, only in a short distance right out here on the side. He's running around your waist. He runs around your waist and he fans down and he goes, but he does not contract up here in the front. He discontinues here. His fibers, his connective tissue runs around here. His connective tissue runs down to the spine, around this muscle right here, which is the quadratus lumborum. He goes around the quadratus lumborum and it feeds into the spine at the same time, but it's only fascia that goes there. He joins with the fascia of this muscle to go into the spine on both sides. So his origin is the spine, but his active tissue is only out here. And it continues around the waist, but it's just fascial tissue in the front. So if he contracts, what he does is pull the waist in small. And so you say to yourself, make your waist as small as possible, and you pull in. And we do it on the breath to teach you. So here's what I want you to do. Exhale, and when you exhale, make it happen by making your waist as small as possible. Now, I'm doing something here that you don't see. I have pulled, he has started here, and this went tight. You saw the rectus abdominis go tight, but watch this. Did you see it tighten here? And what I want to learn to do is hold that tight, but let this relax. because the rectus abdominis is part of your normal breathing apparatus. When your lungs distend, when your diaphragm drops down to bring air into the lungs, the stomach has to distend to let that happen, right here. And then when it goes back, it just collapses back when the diaphragm drops back up. When it relaxes and goes back up, the stomach comes up. So this part of the waist is part of the breathing mechanism. So it is supposed to be dynamic or soft. This part of the waist down the side where the transversalis sits, that's supposed to be your strong area. And most people are not targeting that. They're targeting this. And what I need you to do is contract and find that. When you find that, you feel the whole back. You feel that tight and you feel that tight. And what I want you to do is learn how to hold that and let that go soft. To exercise, though, if you're trying to get as much tone as you can in the waist, 7 times a day, 7 breaths. Do it like that. And then after that, just try holding the back and letting this, learn how to hold that in the back tight so that you keep the lumbar lordosis, because you can feel the lumbar spine tight now. And yet let this be soft. That's the goal. Again, the prescription is 7 times a day, or if you're in distress, your back is sore, you want to come out of it, instead of just getting your shoulders high and your neck high, pull your stomach in. That's what I would add to all those people who do an exercise. When they come out of pain, they just say, a lot of workmen do like this. They say, and one of my nephews told me, he thinks of that is he straightens himself up. After he's done work for a while, he'll straighten up. Well, my attitude to that is make sure you put this in. When you straighten up, pull back on the stomach and make the contraction about the contraction of a yawn. I used to call it yarnercise. And then come out of it and back that pain away from you. Learn to hold yourself erect like this all the time. Learn to engage. That's your goal, is to learn to stand up straight and sit up straight all the time, which means learn to hold just this area right here in the waist tight at all times, but softly. Just don't let it go mushy, because once it goes mushy, the waist, the back softens. As long as it's tight, the back is upright. That's how you keep your lumbar spine. That's how you engage your lumbar spine. So I just told you how to engage your lumbar spine. Once you do it, you will get firm in there. You will have your contour in the back. So that's your goal, is to keep your lumbar spine right here tight by contracting that back part and learning to let this one go and breathe normally. You have to practice. Okay? Next, I want you to widen your chest. The next one is the rib cage. It's not the shoulders. This is what it does. It takes a person from around back, collapsed chest, with the arms in front and the head in front, to chest express, back flat. This goes up into the thoracic. We do it by 2 means though. 2 pairs of muscles. The 2 pairs of muscles are represented by 2 triangles. This means widen. This shows you where it will contract. This means widen. This will show you where it's going to contract. Well, let's go to the bottom one first. Let's go. We got the lumbar right now. Let's get the lower to widen. What you want to do is you want to widen your lower ribs. push them out like that, okay? When you push them out like that, make them wide right there. Another way is, it sometimes feel like I'm just pulling these apart, making the space between here and here wider by doing like that. Once I do that, here's what you'll find. Once I widen that space right in there, I widen that space in there, I feel the contraction up here. Widen, widen right here, widen. Find out where that contracts, up here. And the reason is, the muscle that widens is the serratus anterior. He goes up to the back of the scapula and joins in, connects in with the rhomboid who goes to the spine. So the area of the spine that's made to contract is up here in order to pull that out. Pull it out, make it wide, and feel up here get tight. You've now made this tight by tightening that. Here, if you go here and tighten here, widen here, it's the pec minor, and from the pec minor, you, in order to pull that up and out, because that's what you just told it to, out, okay? Pull him out, widen that. The muscle that had to do it was the lower trapezius. So widen that and feel your lower back straighten. Now if you widen both of them, feel your whole spine. You got your lumbar spine now tight, and you got your entire spine up to here, feeling tight. By just widening your chest. Widen both areas and feel your chest. That's how you activate your spine. You got it to extend. You got it to go tight, because that was the only way for you to widen those muscles. The spine in certain areas had become the anchor for those muscles to become tight. So there you go. Make that happen. And now if you got this wide, that your whole back is now active up to about here. Your chest is widened. You've gotten rid of the round back that comes like this. You did it like that. That's how you got rid of that look like that. Well, you had to get here first, and then widen and widen. Widen here, and feel the whole spine go wide. We're now through with the thoracic area, and now we're about to go to the cervical. So that was 4. Here comes 5. 5 is a circle within a circle, and what that is the muscular neck and the visceral neck, are the trachea. The trachea, when people have bad posture, you see the trachea sticking out. This area slants, the head goes forward. There it is there. What's happened now is, this is the muscular neck, and the trachea has escaped. And where it went wrong is back here. You look at these vertebrae here, and they're wide open. So there's a bend here like that. The reason your head's forward is there's a bend like that. And what you got to do is that. That's what you do. And all you do to get that is throw your head back. Just throw the weight back. You got the rest of it tight. Now throw your head back. Once you throw your head back, you feel you did that, throw your head back, with the serratus posterior superior. But since you displace your weight backwards, you just displace your weight backwards. And at that case, the serratus posterior inferior, you feel it engage. Once you throw your weight back, you can feel back here engage. Now, you've just created a longer waistline, and now it's a good time to pull up on the transversalis in the lower. Just pull this area tight at the same time that once you feel this area engaged because you threw your weight back, know that you've increased space in your waist, and now take that slack up by pulling here, okay? We've now gotten our head in the right position. We can't hold this position, but this is it. I want you to do one more thing. Suck your tongue up to your palate. Just suck it like there's a small seed of something, a little bit of piece of candy or something under your tongue, in your tongue. And make a vacuum up there and trap it up there. Now hold right there, and we're going to level. That's level 5. And what we've done is put the two in line with each other. We've taken the neck and straightened it up, but the head is too far back. Now, I like to do it like this. Just look at me and watch me. This is to make sure I don't come down by doing that. I want to keep the head back. I want to keep the neck back, but let the head drop to the horizon. And then push your tongue up in your palate if you want to reestablish the angle between your neck and your cervical spine that makes that slant that a lot of people get surgery to get rid of. Well, when you drop that head down, push the tongue up into the palate. And if you're younger than me, you'll start clearing this. And I'm hoping with time to see better clearings up in here because we're getting this angle back. Just pushing my tongue up to the palate, softly. So that I get that hyoid to settle in. And all those things that have been stretched down go back up. That's level 6. And level 7 is level 7 is push down on your ischial tuberosities. Make sure it's down in the chair, and then just lift up, holding all your points. And move. This is where you move. And move softly, move erratically, move, but at a lifting point. Lift and hold high. Hold high and move. And look at the spine, at how it looks. And I can move at the chair level. I can move around in circles. I can bob, I can twist, I can bob. But it's all small, and it's all not all the time. It's shifting around from one to the other. Make it sort of like you surprised what you did yourself. You just moved. That's all you know you did. And once you start moving, go inside and feel. If you feel a feeling there that's pleasant, which I expect to happen at some point or right now, know that your body releases endorphins with movement. The body rewards right movement. Body rewards you giving it what it needs. And you will find out that you will start feeling it feels good to be up here. And hold all those points, but softly. Widen the chest, both areas. Check that head to make sure it's back. Lift that tongue up. Lift your whole body up. Rock from side to side on your ischial tuberosity. Rock from around in a circle or back the other way, front and back, side and side. Make a star, write your name. It doesn't matter. Just move. Move softly and hold all 7 points. This is the exercise that helps, that brings you back to plumb with gravity. This is the one. Okay, this is the one that eliminates pain. Okay? Play with it a little while. I want you to record your progress. So use your camera, use your phone, use your smartphone and record as a video and a snapshot. Give yourself snapshots of yourself in your normal sitting position. How do you sit? How do you normally sit in that chair you sit all the time? Record yourself in your various sitting positions, your various, how do you work? How do you sit at work? How do you sit when you're looking at TV? How do you sit when you spend a lot of time? How are you sitting? Record that. You'll see your pain in there. with time. You're going to record your pain on one of your pictures. But after you look at your pictures, you'll start knowing yourself. One of the things you have to do, I'm preparing you to age with this. See, everyone accepts that by 80, you should be looking round back. I say, you're only doing that because you didn't know how to get out of it. I'm trying to prevent that, because if you're in pain now, some of you are young and you have pain. If you're having pain and you're 50, compared to me, you're young. Can you see yourself living to 80 then? Do you know that that pain will get worse? Do you know your pain will get worse if you take a seat and don't know how to sit? So I feel sorry for people who are retiring and then ready to take a seat and sit wrong. That's the reason some people age so much faster after they leave the job than before they left the job, right? They took a seat and didn't know how to take the seat. Learn how to sit before you retire. Learn how to make sitting your exercise. This isn't very vigorous exercise, but this is necessary exercise. So use your camera to take views of yourself and record yourself. Listen to one of these videos. I don't want you to listen to this video one time. I need you to use the juice out of this video. Keep on coming back to the video, but vary it. Take your camera and put it to the side and record yourself in side view as you do the video. Then another time, just turn that on with the sound and watch yourself as you work out how to do it, right? And then sort of work in between. Show yourself what you're doing and watch yourself get better, okay? Use your camera. Next thing, document your body change. And the body change I want is waist-hip ratio to get better. Look it up. Google waist-hip ratio and see how important that is in health prediction, and know that this is the way to change your waist-hip ratio. This is how to use muscles that are not insulin insensitive. Those muscles that you use to sit up straight, they don't know about insulin insensitivity. Some muscles, when you have type 2 diabetes, you use some muscles that you're sitting here and you're using your arm, but those muscles can get to be so they ignore insulin. If too much sugar, too much fat gets in those muscles, they stop burning insulin. These muscles don't know about that. They're gonna burn insulin if that's what it got to do to get food. You know what I mean? So engage them, put them in action. Okay, and watch your waist-hip ratio change. The next thing is, if there's an imbalance, okay, let's say you look at yourself, although I find cameras deceptive. If you look at yourself because of the slope, but if you look at yourself and you know you have a scoliosis, so that's the high side and that's the low side. Exercise needs to address the high side, the one that's long, because if this is erect and that's not, you cannot. Muscles only pull, so there's nothing a muscle can do to address that on that side. It's only by telling this one to erect, strengthen, that you can balance out your imbalance. So know that. Strengthen the elongated side, the one that's long, so that the foreshortened side relaxes. That's how to individualize this. And then over them, take one of these set of pictures and take a picture of yourself and draw your pains on that picture. Get very specific on where it is. It's right here. And then describe it as much as you can and tell it how often it has come and chart it for about 6 weeks. You will, as you go along with this, you will see the pains go, but you will understand how you got that pain. You will understand it later. You will understand it as you grow in knowledge. Okay? You'll leave it, but you'll understand it. Now, I'm giving you an assignment. Your assignment is get a magnum of champagne. If you can find another bottle with a long neck like that, and it's a bottle magnum, I guess that might be some oils, I don't know. There might be an oil or a vinegar in a large bottle, but I know wine, okay? It's in wine. If you don't drink wine, buy a bottle with a plan to give it to somebody for Christmas or something. I need you to learn this game. Here's what you want to do. You want to take a bottle that has a long neck, rest it on your knee, and hold it upright. I want you to see how much work it takes to hold that bottle upright. That's the body held upright. You might think it takes a lot of muscle to hold this up, but this is nothing once you learn how to do it, because there's not much work here. It's a balancing act. You got to turn on your balancing muscle. But now, this is when you're sitting wrong. When your body is like this is it. And even though you're very used to it, this is your source of pain. Just think of the weight that's going there. And now bounce it and see how driving a car or driving a truck without good suspension makes that so much worse on the joints. They got to withstand that. And see that if you bounced with the bottle straight up and down, it would be far less destructive than bouncing out here. That's the importance of standing up straight. When you're not standing up straight and you're not sitting up straight, let me show you just in the joints now. We're not talking about the muscles. If the muscles are out there, think about that bottle. That bottle was not 10 pounds. But if you put that bottle down here and put it up against your head and say that's your neck and that's your head's 10 to 12 pounds. And when you lean it out there, think of why your shoulders hurt when your head is out. If you got that type weight that you got to hold all the time rather than stacking it up and letting the joints just take the weight. Let gravity pass through your body. I want to get you to look at this. This is how it destroys joints, okay? This is ideal. There's the curve of the lumbar spine. We're right about here somewhere. Okay, so there it is right there. And in that, look at the disc, and you can see I've identified the disc by painting them out and giving you a dot. So that you're looking at the same one over here when you look at this one, that one, and that one. And you're looking at the same one here when you look at this one, that one, and that one. Now look at this person. They have tucked pelvis, but that lumbar spine is too flat. Now, you don't see that here because it looks like it's going back, but really, it's not going back. It's a slight go back. It's just exaggerated here. That's too flat. In other words, it's supposed to be curved like that, and that's actually too flat. And what you really have is body weight going this way over it. So up there, that whole weight is coming down, and it's flexing. Look at this. This is supposed to have that shape, and it's going like that, and it's going like that, and it's going like that. Now, here's what I see in that is like your body weight, gravity has these discs, and it's squeezing them in the front, pushing them back. And when you hear people say that somebody got ruptured disc or somebody got disc herniated, this would be a disc herniation. The disc material here got actually squeezed out from the front and squeezed back into this space. And in this space, the nerves to the lower body goes, the lower limbs go through there. And so when someone say they got a spinal problem, and the doctor told them it was a spinal problem, that's the reason they have pain down their leg, that's what's happening. They have this happening in here, and it's squeezing, that bending is squeezing these joints, the pulp of the disc out into the nerve, and they are having pain. Now, if they would sit up straight, can't you see that they would squeeze it back in? And there are studies that show that people have that herniated disc, and then they get right, and the material gets withdrawn back into the disc. This can be helped by sitting up straight. Get your spinal curve right in the lumbar. Establish that lumbar spur. This is what this looks like. This is what this looks like. Now, this is that person, and they're the opposite. They're like this. They got the gut dumped out, right? They're going to have earlier pain. That disc, I've never seen a study, and I don't think it happens. The discal material will never squeeze out there. And the reason is it can't. Because, see, these are facet joints. Here, 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 here. Those are facet joints. Those are joints that guide the movement. You see, they've opened up here, but here they're normal, and here they have closed down. And these facet joints don't have, see, these are real thick. You know, they're real thick. These are thin. These are very thin coverage. The cartilage there is thin. And you put that bone together, osteoarthritis. They get another problem of osteoarthritis in the spine. And that will make spurs that will go and pinch the nerve too, right? They got a pinched nerve again. But it came from a different area. And the correction of this is this. Sit up straight. Engage. Engage. Get your pelvis in the right place and upright your spine. Correction of posture will eliminate problems. Another way of saying it, your spinal problems are coming from your bad posture. You need to see that. You need to see that, not just suffer from it, not run to somebody else and say, fix this. Learn to fix it yourself. Get to know yourself. You got a life expectancy. Life expectancy in 1900 was 50 years. In 2027, 24, in 2024, it's 79 years old. You got a much longer life. They are saying some of us gonna make, a lot of you are gonna make 100. If you're hurting real bad in your 40s, 50s, and 60s, you gonna really go enjoy those 90 years. I suggest you learn how to sit up straight. So if you're blessed with many years, they're less painful years. You know how not to let it go downhill. Every one of us had a good start. We started off a good start. This baby right here has kept his good start. There's the erect posture into young adulthood. These young men don't know about erect. I don't know why he holds it erect. His mama might have told him, whatever he does, that's him. He is in much better position than these babies to go into, especially if he keeps that. By the time he gets here, he's still here. He's still erect. He's older. His skin is older. A whole bunch of things are older. His hair is gray. But his posture is strong. His stride is strong. He's not stumbling. You know, you can't sit like that like it doesn't matter. It does matter. Learn to sit up straight. You were gifted with it. You've lost it. Now go back and get it. Go back and get it. And the way you're going to have to do it is you don't have, I can sit like that sometimes, but you can't spend much of your time like that. You've got to slowly make yourself learn to be the person that everybody wonders, why is she standing up so straight? I'm trying to make it so you're not unique. I'm trying to make sure everybody knows how to do this. In a population where everybody is getting older and we expect it to live longer and longer, as our life expectancy gets greater, we need to sit up. We need to know how to sit up straight. We need to know the importance of standing up straight. We need to know how to correct ourselves. End with thanks. Again, I want to thank you for coming. I want to say return. Don't use this video one time. Do it around 5 times. Digest it before you go to something new. Because the instruction on how to sit up straight, I might say it different in another video. But get to know this one first. Repeat it. Repeat it. Record it. Look at it in different settings. And what I mean by record it and on your video. And then play your video on the TV. And listen and watch yourself listen to yourself, record it with you doing it, right? Then you pair yourself with your computer, with your TV, and then watch yourself do it and see how well you're doing. And then do it again and watch yourself get stronger. You need to know who you are. You need to appreciate what you do. You need to get so that, I wish I knew how to tell you to split your TV screen so that you're looking at me giving you instructions and then you're looking at yourself doing it. Or if you got 2 TVs, Put both of them on. Put yours on and mine on. I don't know how you link them, but get them as close to link as you can and watch yourself do it while you look at the video. Get strong at this. Get so you know it. Make this your knowledge. Pass it on. If it gives you relief, feedback. Tell me about it. Give me comment. Okay? Tell me what you didn't get, what you did get, what made you feel good, what you found out your body didn't like. Return often. Replay often. There are other videos, I assure you, they teach the same thing. I only teach one posture. The other thing that I do that you don't see is I take yoga so that I keep the rest of my body flexible. I'm learning to sit up straight, but my sister teaches yoga, and I take a yoga class. So go on the web and take a yoga class. Or go into your neighborhood and take a yoga class where once a week you keep the flexibility. But right now, right at the start, learn to sit up straight and then keep it flexible and make it a lifetime. You got to maintain this. You got to maintain this. I will teach you how to walk in it, but I'm teaching sitting first. I've decided the first 5 months, 6 months that I'm out here, that's all I'm going to do. First year, all I'm going to do is teach sitting up until I got a population of people who sit up. Then I'm going to teach standing, and then for the elderly and for you going into middle age, I'm going to teach balance. That's all I teach. All of those are one posture, erect. I teach only one posture. And in yoga, see, yoga are postures. This is one posture, but you can see it's a very detailed posture. And all it's doing is teaching you to plumb yourself with gravity. Come again. I look forward to the feedback. I look forward to you getting good at this. I look forward to running into people out on the street knowing how to do it. Tell me if there's a population of people that I can get to just look at the video. I'm never going to charge. My goal is not to charge to learn this. My goal is to get numbers. I need for this is supposed to be a public health intervention, which means I need everybody to learn how to sit up straight. This would do the country so much good. Look at how many people you see out there with poor posture. And project the pain on them. Those 2 young men that I showed you over there with that bad posture, that doesn't bode well for them at all. Neck pains. And they're not going to know how to get it right because you can't just go at that neck. You got to go after that whole posture. It's all bad. It's all bad or it's all good. And what you got to do is know how to get out of it. I know when I'm in back pain, I needed to do this. I need you to learn to. Thank you for coming. Give me feedback.